Hello. Good morning, everyone. Good morning, everyone.
ये तो आपको म्यूट नहीं करना है, ये तो हमेशा म्यूट रहेगा। अब दोबारा करो।
सिर्फ वीडियो से बोलिए। चलिए। Indian Institute of Public Health, Gandhinagar. On behalf of resource persons who are joining this workshop from the different part of our nation. Now, I would like to invite Director AIIMS Jodhpur, Dr. Sanjeev Mishra, sir, to inaugurate and announce the workshop. Sir.
Thank you. Good morning, everyone. Professor Kuldeep Singh, Team Academics, AIIMS Jodhpur, Dr. Pankaj Bharadwaj, Dr. Vibha Joshi, Professor Deepak Saxena from the Indian Institute of Public Health, Gandhinagar. It's a matter of great privilege to host this meeting on health technology assessment and public health, the new dimension. AIIMS Jodhpur is designated as a center for health technology assessment resource center. And we all know that in these times, technology interventions, whatever we say, all interventions are considered as a part of health technology also, is extremely important. Whether we look at devices, we look at interventions for the public, we look at vaccines, everything gets covered in this. And I'm sure that if we talk about this, we disseminate information about health technology assessment, more and more people, that becomes extremely important, because what is the social impact of the health technology? What is the economic impact? What is the impact in terms of diseases, management, etc. So everything does come under that. The School of Public Health at AIIMS Jodhpur has been collaborating with the Indian Institute of Public Health, Gandhinagar. And here at AIIMS Jodhpur, it's a very active faculty, which is the School of Public Health. And Professor Kuldeep Singh, Dr. Pratibha Singh, and all the other, and Pankaj, and everybody else who is associated with the health technology assessment here. I'm sure with the help of the faculty for this conference from Gandhinagar, from PGI Chandigarh, definitely this meeting will be good and people will benefit by it. And it's again on behalf of AIIMS. Welcome all of you, and really look forward to the deliberations and discussions that would be in this meeting. And I get back to the organizers to take charge and take things forward. Thank you so much.
Thank you, sir, for your kind words. This workshop would have not been possible without your support. Thank you, sir. Now I request Dean Academy. He is also professor and head of Department of Pediatrics with a super specialization in medical genetics. Sir, please.
So, good morning, everyone. Thank you, Dr. Deva. Our director, Professor Sanjeev Mishra, coordinator of the School of Public Health, Dr. Pankaj Bharadwaj, all the esteemed speakers on this workshop. On behalf of AIIMS Jodhpur, I welcome you all. Health technology assessment is going to give a new dimension to the public health, and that is the purpose of this workshop. As we know that the health technology assessment refers to the systematic evaluation of the properties, effects, or impacts of the health technology. And basically, it is a multidisciplinary process to evaluate the social, economic, organizational, and ethical issues of the health intervention. This health intervention can be in any form. It can be medicine, it can be vaccine, it can be use of any device or new technology or new intervention which is related to any field of the medicine, whether it is in the hospital or outside the hospital or in the public. So the most important emphasis of this workshop will be on the public health. How the public health can utilize the health technology assessment. At AIIMS Jodhpur, this has been made the resource hub from the Health Technology Assessment of India by DHR in 2019 December. Since then, we are working with the state government and we are taking ideas from the various stakeholders, not only from the institute, but as well as from the public at large and also from the state government. Dr. Rafiq Ahmed is the nodal officer from the state health agency. He is also in a close link with our institute at the health technology assessment hub. So we are collaborating with the state government to find out certain areas or intervention areas which can be subjected to the health technology assessment to improve the health and ultimately to lead to the universal health coverage to whole of the population. So mission of this is to prioritize the needs of the healthcare. And as we know that the universal health coverage with the post-COVID and COVID, it has given a impetus to the healthcare technology. And we are now many of the aspects of the health technology. Evaluation expert, specialist from IIPH Gandhinagar. From the state, we welcome Dr. Rafiq. And from AIIMS Jodhpur, we have Dr. Nitin Joshi and Dr. Biva Joshi. And along with Dr. Jain is also here in our School of Public Health. We are being assisted with Ms. Deepika Joshi. So in all we hope this workshop will be giving enlightenment to the use of the health technology in the public health. And I wish all the success for this workshop. And we'll be ready to any questions in collaboration or any ideas are most welcome during this workshop. Thank you.
Thank you, sir, for your kind words. Now, I would request Dr. Pankaj Bharadwaj, Vice Dean Research, Additional Professor in Community and Family Medicine, and Coordinator of School of Public Health, AIIMS Jodhpur.
Okay, thank you, Vibha. So I think my screen is visible or not? Share here. Okay, sir. Sir, share one, maybe slides. Share. Above, and is it in the full mode?
Yes, sir.
Yes, sir. Okay, thank you so much. And on behalf of All India Institute of Medical Sciences, Jodhpur, as well as from Resource Center, I welcome you here. And we've already heard Professor Kuldeep Singh sir about the objectives of this current workshop. So, friends, I'll be taking you quickly to the overview and scope of health technology assessment, which we are doing here, and what are the overview of this HTA in public health. But before I start, it has already been mentioned by the Dean sir about the kind of resource centers and technical partners which have been given by Ministry of Health and Family Welfare as well as Government of India. And as you all know that we have these 8 established centers or hubs which are already working in the state, in different states across the country. And would like to humbly agree and admit over here that we are the new center, and out of these new centers, AIIMS Jodhpur has started taking initiatives to contribute in the areas of health technology assessment. So when it comes to the health technology assessment, it is about, if there are not many definitions and not many ideas which have been mentioned, but to say about health technology as an approach,